Welcome to Variations 4. This is the unit on shock, and in this video we'll be covering questions number 4 to 6 of our itinerary. So question number 4, explain the physiology behind hypovolemic shock. And that should be hypovolemic right here like that. Not sure why that's turning up like that. Hypovolemic, okay. There's really not much more to say about, I'm looking at the figure from the textbook, and you don't need to worry about the terms relative and absolute hypovolemia. We can just think of it as we talked about earlier, and there's not much more to say than that. There's either been a lot of blood loss, or there has been severe dehydration. The bottom line is, at the end of the day, what we're talking about is decreased cardiac output because of one of those two reasons, and therefore decreased tissue perfusion. So it's just, that as a term, I mean, if you're going to look at each shock individually, you're separating out septic from anaphylactic, from neurogenic, from cardiogenic. Hypovolemic, strictly speaking, is not enough blood or not enough water portion, and that's it. And therefore, you've got a drop in blood pressure, decreased perfusion, impaired cellular metabolism. It's probably the most straightforward shock to talk about. And if that's your only issue, then it's probably one of the easiest ones to fix. I mean, of course, depending on what's causing the bleed. I mean, assuming the bleeding stopped, then you give a blood transfusion. Assuming it's just dehydration, then you give IV fluids. So from that perspective, it's fairly straightforward. All right, so question number 5, explain the physiology of neurogenic shock. So we did come up against a type of neurogenic shock when we looked at the neurological unit a little ways back. So this diagram from the textbook makes it quite, really does a pretty good job of summarizing what we'd like to say about this right now. So if you remember, it could be, now hold on here, neurogenic shock doesn't have to be from spinal cord injury. We said if the spinal cord injury was high enough, and you can refer to your neurological notes for those details, but we said it was high enough, then that could cause neurogenic shock. This would fall into that category. But that's not the only story. It could be from drugs. It could be from certain sedatives taken that could put you into a neurogenic shock. Or some other kind of injury. So we're not really here to talk about causes, but there's more than one cause for neurogenic shock. What we're here to talk about is what is it? So you've had some kind of cause, maybe it's drugs, maybe it's a spinal cord injury. Sure, what happens? So neurogenic shock, it means the sympathetic nervous system, it's lost its influence on the on keeping the blood vessels nice and toned, nice and constricted to the right amount, and so they become relatively vasodilated. And as you know, the story from there is very straightforward. Blood pressure drops, stroke volume drops, cardiac output drops, etc., etc. You've got decreased tissue perfusion that brings you to shock. Now, on the other side, contributing to worsen this is that while the sympathetic tone is affected, the parasympathetic system still operates uninhibited. In other words, it doesn't have a problem operating. And so the parasympathetic system, its job is rest and digest. So it's slowing down the heart at the same time as the vessels are vasodilating. So this is one of those shocks that's unique in that, as we talked about in their neurological unit, it's both a drop in blood pressure and a drop in heart rate. If you think about it, initially, most shocks, you expect a drop in blood pressure, sure, but you expect the heart rate to be compensating. So again, unless there's some issue with the heart itself, like cardiogenic shock, unless even then someone's having an MI, their heart rate's going to be sky high. It might be fibrillating all over the place and inefficient, but you expect it to be sky high as it's trying to get some perfusion going on. Same thing with all the other shocks, except neurogenic shock. Neurogenic shock is the one that's going to initially have both a drop in blood pressure and a drop in heart rate, because the sympathetic system is held down, but is blocked, so to speak. The influence is blocked, but the parasympathetic system is not blocked. And so that rest and digest response causes the heart rate to drop, even in the face of dropping BP. As we said, that neurogenic shock is at T5 or above, a spinal cord injury at T5 or above, but it could be from meds as well, like over here. And then again, just diagram re-explains what's happening here. The vagus nerve innervation is obviously is able to still get through as it's higher up than T5, so it's able to communicate with the rest of the body, whereas that sympathetic is rated around T5, and so if T5 or above is affected, brain can't communicate with it. All right, question number 6, explain the physiology of anaphylactic shock. So at the bottom of map 4, we've got anaphylactic shock kind of summarized. Obviously, you have an exposure to some kind of antigen. Then you have this response, which we know it's a systemic inflammatory response, which is where your vasodilation comes from, which is where your fluid moving into tissues. So this fluid leaks out of the vascular space, dropping blood pressure, thereby leading to decreased perfusion. This is nothing new. We've talked about inflammation throughout the course and the vascular permeability that comes with it. Of course, bronchospasm is also an element of the anaphylactic response. That can further, because it compromises your respiratory functioning, can compromise your airway in general, can increase panic and anxiety, hyperventilation. All these things can contribute to a drop in O2 in your bloodstream, as well as your edema, laryngeal edema that may come with it, pulmonary edema. Which is why the treatment of anaphylactic makes sense. For example, later on, when we look at epinephrine, not only does epinephrine address the cardiovascular components of the response causing vasoconstriction, it also helps to decrease the bronchospasm. But we'll get to that later. That's the overview of anaphylactic shock.